You hear one word, dialysis, your chest tightens, your thoughts stop, your future flashes in front of your eyes. You imagine machines, needles, hospitals, dependents, and then one terrifying sentence appears in your mind. Once dialysis starts, it never stops. For many people, this single belief is more frightening than kidney disease itself. I have seen patients refuse life-saving treatment. I have seen families beg, "Doctor, please do not start dialysis." We are afraid it will never stop. Some patients leave hospitals, some delay care, some arrive when it is already too late. Today this video is important because this belief is not always true, and believing it blindly can cost lives. By the end of this video, you will understand the real truth about dialysis. You will know when dialysis can be temporary, when it becomes long-term, and why fear should never decide treatment. Dialysis is not a punishment. It is not a failure. It is not the end of life. Dialysis is medical support. It steps in when kidneys are temporarily or permanently unable to keep the body safe. The problem is not dialysis. The problem is misinformation. Let us clear that first. Dialysis does not mean kidneys are dead. Dialysis does not automatically mean lifelong dependency. Dialysis does not remove hope. Now let us understand what dialysis really does. Kidneys clean blood. They remove waste. They remove extra water. They balance salts. When kidneys suddenly or slowly fail, waste builds up, fluid accumulates, the body becomes toxic. Dialysis acts as an external support. It cleans blood. It removes extra fluid. It protects vital organs. Sometimes this support is short. Sometimes it is long. The duration depends on the cause, not on dialysis itself. This is where most myths begin. The biggest myth is this: once dialysis starts, it never stops. This is simply not always true. There are two very different kidney situations: sudden kidney injury and long-standing kidney disease. They behave very differently. Sudden kidney injury happens fast, over days or weeks. It can happen due to severe infection, severe dehydration, major blood loss, heart problems, certain medicines. In these cases, kidneys are shocked, but kidney tissue may still be alive. Dialysis here acts like a bridge. It supports the body while kidneys recover. Once kidney function improves, dialysis can be stopped. This happens far more often than people realize. Many patients need dialysis only temporarily, some for days, some for weeks, some for a few months. Then dialysis is stopped and life continues. But this success story is rarely discussed. Fear spreads faster than facts. Now let us talk about long-standing kidney disease. This develops slowly. Over many years, common causes include diabetes, high blood pressure, certain inherited conditions. In this situation, healthy kidney tissue is gradually replaced by scar tissue. Scar tissue cannot recover. If dialysis starts here, it usually continues long-term, unless kidney transplant is done. So the truth is simple: dialysis itself does not decide permanence. The cause of kidney failure decides it. Now let us address myths one by one. Myth number 1. Dialysis means kidneys are permanently damaged. This is false. In sudden kidney injury, kidneys often recover. Dialysis does not kill kidneys. Delay and toxins do. Myth number 2. Dialysis means death is near. This is false. Dialysis often saves life. It prevents heart failure. It prevents lung fluid overload. It prevents brain toxicity. Many patients live for years, even decades, on dialysis. Myth number 3. Dialysis. Patients cannot live a normal life. This is false. Many dialysis patients work, travel, attend family events, live meaningful lives. Life changes, but it does not end. Myth number 4. Doctors start dialysis too early. This is false. Dialysis is not started casually. It is a carefully considered decision. Doctors assess symptoms, breathing, swelling, mental status, blood chemistry. Dialysis is started when risks of not starting are greater than risks of starting. Myth number 5. Once dialysis starts, there is no going back. This is false in acute kidney injury. Many patients stop dialysis. When kidneys recover, the fear comes from not knowing this difference. Now let us talk about why this myth is so dangerous. Because of this fear, patients delay hospital visits. They tolerate breathlessness. They tolerate swelling. They tolerate confusion. Families wait, thinking dialysis will ruin life, but delay causes irreversible damage. Sometimes dialysis could have been temporary, but delay turns it into permanent need. Fear creates the very outcome people fear. Now let us explain how doctors think. Dialysis is not started based on one report. It is a clinical decision. Doctors ask, why did kidneys fail? Is the cause reversible? Is urine output improving? Is infection controlled? Is blood pressure stable? In sudden kidney injury, doctors actively look for recovery. Dialysis is reduced gradually, stopped carefully, when kidneys improve. For junior doctors, this is a key learning point. Never label dialysis as permanent early. Never destroy hope. Never promise recovery blindly. Explain uncertainty honestly. Now let us address another hidden myth. Dialysis means transplant is impossible. This is false. Dialysis is often a bridge. To transplant, many patients start dialysis and later receive successful kidney transplants. Now one more myth. Dialysis means suffering. This is outdated thinking. Modern dialysis is safer, more controlled, better tolerated. Complications exist, but so do benefits. The goal is balance, not fear. Let us summarize the truth clearly. Dialysis is a treatment, not a life sentence. Sometimes it is temporary, sometimes it is long-term. Outcome depends on cause of kidney failure, timing of treatment, quality of medical care. Fear should never decide treatment. Knowledge should. If this video helped clear your fear, please like this video. Subscribe to Kidney Focus for calm, honest, doctor-led kidney, bladder, and prostate education. Comment your questions below. Tell us what worries you. Share this video with someone who is afraid of dialysis. Correct knowledge reduces fear, and fear reduction saves lives. Thank you for watching.